Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Hey everybody, welcome to Nip Talk. I'm your host, plastic surgeon Dr. Bruce Hermann. For all those watching live and on recording, thank you very much. We do appreciate it. Today I have a guest co-host. This is Sarah Bennett, and she's joining me today.
Hi.
And in the box we have, as always, Travis. What's up, Travis? You having a good week, buddy?
I am. How about you?
It's been good. It's been busy, but good.
You know what? We were talking before the show. Busy always kind of means fast when you.
It does mean fast.
Talk about the week being busy, so it's always a good thing.
Also, when I'm busy, I tend to stay out of trouble. So, idle hands are the devil's playground. So.
I don't believe you get in very much trouble at all.
Oh man,
I don't believe it.
Oh man, we don't know each other as well as we thought we did, maybe.
Oh gosh.
Well, Sarah, so thank you so much for being on today. So
Yeah.
you're a very busy woman. I understand that you're very big on social media. I've watched some of your stuff, which I really enjoy.
Thank you.
An entrepreneur and business owner. Can you tell us a little bit about the things you do?
Yeah, well, long story short, I own a little clothing store on the Denton Square. It's always been one of my dreams to do that. I actually started out with a health degree, and I did that for a little bit, and I just changed.
Yeah,
Yeah.
Well, there's a lot of people that do that. Well, they'll start with one thing, and then they realize that maybe not is what their heart is, set on. So that's really cool, and also very, brave to completely jump ship and do something different.
Starting your business is
And
hard.
as you know, I have been in your store, and I have bought some of your clothes. I really do like them. It's mostly, if I remember correctly, it's mostly women's clothes.
Yeah, but we definitely have men's.
Yeah.
Yes.
The shirt I bought, I really like. In
Yes.
fact, I did a post the other day, and I was wearing your shirt. And I meant to tag you. Sorry. I'm gonna go back and do that. But she does have some great clothes. I love your store. And then on social media, so you've been doing that quite a while, right?
Yes, I would say I've been a social media influencer probably for about 5 years.
It's awesome.
It just now I started making it my own. So.
Yeah. And you're very popular. I saw your stuff. I was like, wow, you have a lot of followers. It's very impressive.
Yeah.
I know I know because that's how I started all this, was doing it on social media. And for those people who look at these huge accounts, it's hard work. It's a grind. It's consistency and putting out good content, and it's very impressive what you've done.
Just trying to be as authentic as possible.
Yeah.
I think that's something that people really appreciate.
I do too, and I think about some of the other plastic surgery people on social media. A lot of it is kind of fakey, and I look at some of those and but I try to just be myself, and whether that's good or bad, I think people appreciate it.
Yeah, they definitely do.
So I just want to talk for a little bit about Denton, where your store is, because I actually grew up in Louisville, which is the next city down from Denton, but I went to high school in Denton. And I consider it a sort of my hometown, since I graduated high school from there. Right. And I really think that city is a hidden gem in the Metroplex.
And it's really grown a lot.
It's getting kind of big. Travis, have you been up to Denton?
You know what? It's been a while since I've been to Denton. Maybe I would say probably 6 months.
Oh, that's not too bad.
Yeah, Denton and Dallas is a really weird distance from each other. It's not too far, but it's not too close either.
Yeah.
You know
People,
what I mean?
The Metroplex is so funny because it's so spread out,
right.
And so when I've lived in other big cities in the United States, and I remember when I lived in Louisville for a while, I lived in Tennessee, Michigan, and I remember living in those cities, which are, Louisville is 1.5 million. If I had to drive 10 minutes, I was like, oh my God, I have to drive all the way across town. In the Metroplex, we think nothing about driving, almost
30,
an hour. 30 minutes or an hour to go to dinner. It's just so spread out. But anyway, I do think that Denton is kind of a hidden gem. I kind of compare it to Austin. It's like a mini Austin. It's very there are lots of arts, lots of places to go out, and the Denton Square, for those people who are not familiar with the square scene. So I think I brought some pictures there, Travis. Well, I have a picture of your store. I want to show that.
Hey, there she is.
Yeah, I love it, and it's in a great location too.
Yeah,
your location
little
is
corner
really good.
store.
Yeah, it's a corner store.
Cute.
But yeah, I just drew some pictures. So that's the Denton Courthouse, which is a beautiful architecture building, and then the entire square around it is shops, restaurants, bars. In fact, I'm almost, hesitant to say this, but Sarah and I actually met through some mutual friends when we were doing...
At Howling Mutt.
Yeah, the Howling Mutt.
Yeah.
We were doing a pub crawl through Denton because there's so many just really cool, unique places within walking distance.
I think the last time I went to Denton, there was it was either an ice cream shop or
Beth Marie's.
Is that what it was?
Yeah, it's right there on the square. It's so good, right?
Yeah, that's been there since I was in college.
Yeah.
So 07, 08.
Well, and so many of these places have either, all this rich history and just this kind of unique character. And I mean, there's literally too many to list within a half-a-mile radius.
Yeah, and something that's really unique that Denton has is that little bar, Pascal's.
Oh my gosh, yes, I love that. I wish I'd put a picture in there. You know how I describe Pascal's?
What?
Because I tell people about Pascal's. You probably haven't been to Pascal's, have you, Travis?
I've not been to Pascal's.
Dude, Pascal's, number one, it's a speakeasy. There's no signage.
Yeah.
You have to go in almost this hidden door, and I describe it as what Sherlock Holmes's library would look like.
Yeah, all their drinks, I swear, are made with smoke. Every time I get
so,
a drink, they're pouring smoke.
I know, every
into
time
it.
you buy a drink there, it's it's a production.
Yeah.
And it's just so cool. It's couches and books and games. And the only downside to Pascal's is it's small. And so sometimes
there's a wait.
You have to wait to get in, which is crazy. So
yeah,
I do think that Denton is kind of a hidden gem. I just really, I do love going out in Dallas. I mean, Travis, I've told you about this. My wife and I, we go out all the time downtown, uptown, Design District, Deep Elm, all that. But, Denton's really kind of its own unique area. I don't think there's anything really like it.
Yeah,
in the
it's a very prosperous square.
And it's getting busy. Yeah, it's getting a lot
You hit the nail on the head and put it perfect. It's almost like a little mini Austin.
Yeah, it is.
It is it's very creative. It's very quaint. It's very, but it's still big at the same time.
Yeah.
It's because of those colleges. UNT became a really big art.
Oh, totally. Yeah, UNT, TW, they have some great colleges there. In fact, my wife actually works at UNT. She's been there for 10 years. Yeah, she's the executive director for the Student Health Center, which it's a pretty good job. And
nice.
Bragging on her, she's the one that helped them kind of get through COVID. She was their main COVID person, and she was on the news talking about COVID. Yeah, it was kind of funny. I'd be sitting somewhere and I get a text. Your wife was just on Channel 4 News talking about
fun.
COVID. Yeah, it was kind of cool, but. All right, so anyway, if you live in the Medplex, check out Denton. It's a great place. Go to the Rose and Thorn. I love that place.
Come shopping.
Okay, so I want to move on to one of my favorite segments, which is the Dr. Hermann Plastic Surgery 411. And what this segment is I talk about some topic related to plastic surgery. And I think today's is going to be a little controversial because I'm talking about the procedure that's very popular in plastic surgery that I would not let my wife do, and nor do I do them in my own practice, and that is the Brazilian butt lift.
No, I have.
So, Travis, have you heard about the Brazilian butt lift? I love that picture.
I have.
You have, so you know about this.
Yeah,
okay.
I have.
So it's a very popular surgery these days, and it's gaining a lot of popularity because it's seen on social media a lot. My feed is just full of befores and afters of Brazilian butt lifts. And then also there was a recent article in the New York Post, which I think I brought a picture of that, Travis, talking about how the increase in the plus size models are driving these plastic surgery trends. And one of them was Brazilian butt lift, the other being breast augmentation to get these kind of curvy figures. And so I honestly, for one, I do appreciate that more normal women are becoming models. I don't know, I think back in the 90s, early 2000s, to be a model, you had to look
unhealthy.
Like you were starving, right? Yeah. And so I do appreciate that these more normal women are getting to be very successful models. And I can't remember a lot of their names. Iskra is one that I've seen, and I don't want to say their names wrong, so I won't list anymore. But do you know any of them? There's a ton of them. I see them on there, because my feed for social media is a lot of health and beauty. Just I'm trying to keep up with what's going on. And anyway, so they're gaining popularity. Well, what's happening is with their gain in popularity, like certain things, like procedures are popping up to help people look like them, you
Right.
know. And so, so obviously some people may not know what a Brazilian butt lift is. They might think that it's like implants or whatever, but what a Brazilian butt lift is when you do liposuction in one area and you take out that fat and then you inject it into another area, which in this case would be the buttocks area. And I think I brought a picture, Travis. The next one I think is me doing some fat grafting. I wasn't doing a Brazilian butt lift because I just don't like those, and I'm going to kind of go over those reasons for that. But you know, you look at those post-op pictures on social media, and they do look good. Yeah, here's the picture of all that. Can you see that?
That's all fat.
Yeah, that's all fat.
Wow.
So I was doing that for a reconstruction case, which I'll kind
Okay.
of talk about at the end. But yeah, those are all syringes full of fat, and that's the little system that I use to harvest it. But I want to talk about some of my concerns with Brazilian butt lift because I'm not sure that every plastic surgeon is going over some of the potential issues. You know, one thing that I do, and I think it's very important when I talk about any plastic surgery procedure to people, is I don't want there to be any surprises. And so when there are like downsides to things, I really want to educate patients. Okay, these are some of the things that I'm concerned about. I want to make sure you're aware of them and that you're okay with these potential risks.
Right.
And so probably one of the first things I think about when Brazilian butt lifts start to pop up is a lot of the girls that are asking for these things are they themselves not bigger girls, right? Because if they were a little bit more curvy girls, then they might already have the buttocks that they want. So the first issue that kind of pops up is, does the patient even have enough fat to donate to do the surgery? And where that becomes even a bigger issue is when fat grafting first came out, which it came out right when I kind of hit plastic surgery in the mid-2000s, and it was kind of a new technology. Like, we really didn't know how to do it the best way. And so we were literally just pulling this fat out and basically just rinsing it with some saline and tossing it right back in. And what was happening is a lot of that fat would get reabsorbed. It just wouldn't survive. And so as the years went by and technology got better, we learned that there are certain techniques to make this fat survive better. And the one I use is called Revolve. It was one of the pictures that Travis showed earlier. It's basically a machine that the fat goes into, and it basically washes it and kind of almost centrifuges it. And so the fat that goes into it doesn't look that great, but what you pull out is it's almost creamy. It's very thin, it's not thick or chunky, and all the byproducts are taken out. And so when you do that, you get a much higher take of the fat, because that was the biggest issue with fat grafting is you inject it, it looked good right away, and then 6 months later, up to 70% of the fat's gone. It just didn't survive. But the problem with the processing is you put in a certain amount and you get much less back. And so the technique I use, which is really, really good, if I put in 1,000 cc's of fat, I only get out 300, maybe 350.
Wow.
And so where that becomes a problem is you think about fat grafting of buttocks, each side could take anywhere from maybe 300 up to 1,200 cc's of fat, and that's just one side, so you got to have double that. So you think, okay, I need 600 to 2,400 cc's of fat, but if you have to multiply that by 3, then suddenly you need 2,000 to 7,000 cc's of fat to have the proper amount. And that becomes a problem for two reasons. One, most people don't have that much fat to donate.
Right.
And two, when you get into the 4,000 to 5,000 removal part, or 4,000 to 5,000 range of fat removed, you start to cause some shifts in the hemodynamics that can potentially be very harmful to people. So I kind of draw the limit around 4,000 cc's of fat that I'll pull out at one time. A lot of people say 5,000 is safe, but anything over that starts to get a little bit dangerous. And so, there is that issue of do they have enough fat? Then secondly is the reabsorption. And, I've done a lot of fat grafting, because there's probably surgeons out there being like, oh, well, this guy just doesn't know how to do fat grafting. No, I mean, I've been doing it since the beginning, more for reconstruction, and I'll talk about that in a second. But the issue is the reabsorption, because you don't want to go get a surgery and then suddenly 6 months later, the result's all gone.
Yeah.
You're going to end up being unhappy, right?
Yeah.
And especially if it doesn't reabsorb in the same amounts. And so that's the other issue. And finally, well, not finally, but another issue I have is when you do fat grafting, sometimes that fat will survive, but it'll end up being almost scarred or hard, and you can kind of feel it, I mean, because nobody wants to have, a breast or a buttocks that doesn't feel normal, right? I mean, it's one thing to look good, but I mean, if you have something hard and you're sitting on it, that becomes a problem. I've had people tell me that, they got a Brazilian butt lift, and suddenly it's kind of uncomfortable to sit in certain positions, right? And then lastly, this is probably the big kicker for me. So when you look at plastic surgery and what is the risk of like the worst outcome, which would be death, okay? We talked about this in a recent episode that for like your basic plastic surgery, the risk of mortality or death is very, very low, around 1 in 300,000 surgeries. So most plastic surgeons will never have a death, you know, because in their career they wouldn't do that many surgeries. For Brazilian butt lift, the risk of mortality, and one of the recent papers that came out was 1 in 3,000. That's 100 times more likely to die. And so people will ask, okay, so why is that surgery so dangerous? Well, it comes down to the fact that when you're injecting fat into someone, if you were to accidentally get your cannula into a blood vessel and then inject the fat in there, you'll get what's called a fat embolus, which is a very, very lethal problem. Now, it's not common because most of the time if you go through a blood vessel, it'll just go right through it and then you're not really injecting the fat into it. But with bigger blood vessels, it's more likely. And so, you know, that high mortality rate for me, combined with all these other issues, like, I'm just not interested, you know?
Right.
And one thing for me is, fortunately in my practice, I'm pretty busy. I can, to a certain degree, pick and choose what I want to do and still, you know, keep the lights on.
Right.
And so, you know, when it came out, I was like, okay, this is interesting because I had done the fat grafting for breast reconstruction. And I've done a couple for augmentation. You know, if you get, like, say, a girl that has, like, maybe, like, a large C breast and she only wants to go up to, like, maybe a mid-D, it's hard to use an implant to do that because you have to use a tiny implant and they don't fit. And so I fat grafted a few breasts, but in that you're injecting less amount. You need less amount to pull out. And so, so yeah, I'll do it for that, but I just never really kind of bought into Brazilian butt lift. And I kind of feel like in the future it's not going to be as popular, and maybe I'll be wrong, I don't know.
It's totally a fad, I would say. Like,
Do you think
bigger
so?
butts right now.
I don't know, and you're right. So there's that whole part of like, is this just a trend in aesthetics where right now people want to have that, and suddenly we're back to the 90s where Kate Moss is like the perfect woman.
Fashion trends definitely help spear that along.
Now, I know that you're like big into working out, right?
Yes.
Do you see, and I used to be in workout, but like I have to say I've been kind of slacking lately and I don't like work out as hard as I used to. Would you say people in the gyms and the groups that you go to get similar results from working out? Or do you feel like people maybe work out in an effort to try and do that? Like,
oh, for sure. One of my really good friends, she was always super small, like a beanpole. Her legs were so skinny, all of it. She started lifting weights, doing weight training, and she got bigger. Like she just, her legs and her butt, they look great. And it's just from working out, doing those deadlifts, doing those hip thrusters.
And of course that, is dedication to extreme hard work. You
it took a while.
You have to be really dedicated to do that.
And
it
nutrition.
takes time.
And
nutrition, time,
Yes.
I mean, that's hard to do.
Consistent stuff.
I know that, people have asked me about, okay, well, can you get the same result from working out? And it's a great question because definitely building muscle does help, increase volume. My only concern with that, if somebody asked me truthfully, can I get the same result, by working out? Part of the issue is going to be that, muscle is only part of the volume of your buttocks. And so one concern might be that if you're working out that hard, that you're reducing your fat content, because that does happen, right?
Yeah, genetics, I think, has a lot to do with it.
It does, totally. I look at these girls, like these kind of curvy models, and and maybe some of them have had surgery, but like it's hard to tell unless they outright say it. But I think just a lot of them are just genetically shaped like that.
Right. I've always been super athletic build, so gaining muscle for me has never been an issue.
Yeah.
But for my friend, gaining muscle was always her issue. Yeah. But she found a way through nutrition and just being consistent and working out.
Well, and it's a conversation that
But it took years.
Right. Yeah, it takes a long time, and that's a conversation I have with my patients sometimes because. Not necessarily for Brazilian butt lift, because I don't even really see patients for that, but like for other things like tummy tuck, patients will ask me, hey, can I do this on my own? And I'm always upfront with people, like, especially for things like lipo, yes, if you're coming in just for strict liposuction, you can do that on your own.
Yes.
It's very hard work, and some people can't do it, and therefore this is an alternative. And then some things with plastic surgery you can't. Like, I'd say Brazilian butt lift, maybe a little bit, but some things like tummy tuck where you get like muscles that are spread out that have to be repaired, like, sometimes surgery really kind of is the only answer. So, but it's an interesting conversation.
Right.
I don't know. I may catch flack for like poo-pooing on the Brazilian butt lift because they are so popular. But,
right.
But I don't know. Like I I would feel very concerned if like one of my family members was going to go have one. I would like have to sit them down and like walk them through every potential issue that I feel is possible, and then be like, okay, you sure you want to do this?
Right.
You know, I don't know. We'll see.
Good points.
I'm probably going to catch some flack off this one. All right, moving on. That was a good conversation. Travis, what do you think the Brazilian butt-lift's good? I don't know.
It's not that I think it's good or bad. I do think, like she said, like Sarah said, it is a fad. You see it a lot on social media.
You think so too?
Oh yeah, a lot of people are even like using it as like comedy. For like skits on Instagram.
Yeah, TikTok.
Yeah, TikTok.
There's a man that walks around with like literal, it looks like he has like the most obnoxious implants in his like khaki tight shorts. And it is like, it's ridiculous.
I haven't seen that. I'm going to go look it up.
Social media has made it a fad almost. So, yeah.
We'll see. I wonder, because that's an interesting question. Is it going to like be less popular just because people don't want it anymore because, you know, the times change? I more think that like it's going to eventually, enough people are going to say, well, yeah, I did it and it was cool at first, but like a year later, I'm not sure it was worth it.
Yeah.
So I don't know. We'll see. I'm not always right, obviously, but. Okay, so I want to do the next segment on some health and medical news because there was a really interesting article. I have this buddy Eggman. He's always sending me this stuff, and like it's really, I don't know where he finds it, but like it's really good articles. And so he sent me this thing, and I think I brought a picture of the article, Travis, and it's basically from the Development Cell Journal of June of this year. That is a possible cure for hair loss, and it basically involves a signaling molecule called, and I'm going to crush this name in a bad way, SCUB3, SCUBE3. I hadn't heard of it. I had to look it up.
Okay.
And basically this is a signaling molecule that tells the hair cells to produce hair. And they did this study in mice, and they basically they induced baldness in mice, and they injected this peptide into this tissue, into the skin, and suddenly the mice grew hair. And then further, they grafted human hairs into a mouse that were dormant, and they got human hair to grow on a mouse, and actually really like kind of lush. And it's pretty interesting because I'm sure a lot of people don't understand like the kind of the biology in hair loss. And what it is when people start to lose their hair, it's not that the follicle dies. Okay, I think a lot of people think that the follicle just croaks and it's dead. It just goes into a dormant phase. And I read a very interesting kind of analogy of when someone goes bald, it's like they have 100,000 3D printers on the top of their head that are on and functioning, and they're just waiting for somebody to hit the start button. That's all it is. Like they're just waiting for the signal. And this peptide can be the signal, this SCUB3. So I read the article, and it's very interesting, honestly. I think that it's something that is definitely going to continue in development because it's just an animal model now, so they'll have to do human trials and make sure it's safe, and then FDA approval, and it might be, 5 years before you ever hear about this again.
Yeah.
But it is very interesting that something that can be synthesized could either be injected or maybe something topical that would cause people to completely reverse baldness. And so I always like to hear about that. I've been amazed in my career with some of the advances. Like in medicine. I'm
not gonna lie, Dr. Herman. When you were saying that the mice were injected and they had this long, like lush hair, the first thing that popped in my head was like rock star hair, like Jared Leto or somebody.
I wish I had a picture of the mice. I'm gonna look for it.
That might be dope.
I did some research. Of course, I'm always like digging, trying to find more information. They didn't have any pictures of the mice, but
I literally pictured a little mouse with a little wig on.
Oh my God, that's an opportunity.
Like a mullet, that'd be cute.
A mouse with a mullet.
Yeah,
that would be adorable.
Jason Momoa mouse.
I'm gonna. All right, I got some homework. I'm gonna try and find a picture of these mice because when I was looking this up, I was like, trying to pull it up, but I didn't find the mice. But I'm gonna go and dig deeper, see if there's like some black market pictures of these mice with like the rock star hair. I can imagine like 80s hair. Yeah.
Exactly.
Definitely.
So yeah, I think that's a very interesting study, and so it kind of got me thinking about, baldness is a huge problem for people. Both more men, but also for women. And so I just want to talk a little bit about like, okay, this isn't available yet, but like what treatments are out there. And so one of the first things that you might consider, and I started at the lower rung, right? I don't want to jump in to go have surgery, right? Because if you can solve a problem that's with a simple method, it's always easier. And so I started looking at some of the supplements, and there is one nowadays that's very popular. It's Nutrafol, and I brought a picture of it here. And it's been around for years, and this is a kind of an all-natural supplement. It's not a prescription. And I looked into it. I've known about it for a while, but I did a little bit more research into it. And it's actually a pretty good supplement. Like I was looking.
It is. I've worked with them before.
You have?
For social media, yeah.
You have? Oh, that's so amazing.
Yeah.
So now, did you take the product, or did you have someone you know take the product?
I took it just because I've always wanted to have thicker hair.
Okay.
My hair's always been naturally thin. Genetically, so it's just
I have
how
the
it
same
goes.
thing. I have very fine hair. But
Yeah, like every time I go, get to my hair cut, they're like, "Your hair's really fine," but it's cool because I'm always like, "Am I going bald?"
I know, right? Oh, yeah, I know. That's like the fear of
Am
all
I losing
young men,
hair?
right? Yeah.
Getting
you like
older.
you're counting them in like the drain in the shower.
Yeah.
Like, wait, is that too many?
Yeah.
So okay, so you took it for a while. Did you notice difference?
I did. I like to play around with different supplements. I think I told you a while back that I take collagen too.
Right, okay.
I just like pour it in my coffee, and that's good for. It's supposed to be good for your hair and nails and stuff like that.
Right. It's one of the building blocks. Yeah.
Right. So I play around with stuff like that, but I'm really bad at being consistent.
Okay.
So
Yeah. I did read about the Nutrafol. You do have to be consistent
Yes.
with it. So, but you say you have a positive experience.
Yes.
Okay. Well, I want to just kind of briefly talk about it because it is very popular. It has a few ingredients, and they're all natural. And basically what they do, and I'm not going to go through this extensive list, but what it does is it helps cut down those hormones that cause these hair follicles to become
go to
deactivated.
sleep,
Yeah,
yeah.
to go to sleep, right?
Yeah.
It's DHT is the main one that causes these hair follicles to kind of go to sleep. And so it has like these all-natural ingredients that help to bring that down. Also, it helps regulate your cortisol, which is your stress hormone. Stress causes your hair to start to lose hair. So it has an ingredient for that. It also has lots of nutrients both for the hair follicles themselves and the scalp, which promotes a healthy environment for hair to grow. And lastly, it has antioxidants and anti-inflammatories, which can also cause hair loss. So it has a lot of products in it that you would think would help your hair be stronger, fuller. For me, I'm always about show me the research, right? I mean, I know it's your first show with me, but like in all the past episodes when we talk about stuff, it's like, okay, what does the research show? And there actually is a study out there that looks at Nutrafol. It's from the Journal of Drugs and Dermatology from 2018. And in fact, I know one of the doctors, Sophie, I think Keegan or Kogan, sorry, Sophie, if I butchered your last name, that's one of the authors of the paper. And it was a randomized trial, which means it's a good trial. There's different levels of how good research is. And it did show that there was significant improvement in hair growth with a continued use of the product. And so it does have the research to back it up. So for supplements, I do think it's a good thing. It has a little bit of a cost to it. I think that if anything, that might be the downside. But I think that you can get it cheaper nowadays. I didn't do a whole lot of digging, how much it costs. But I mean, all those supplements cost money. It's not like any of them are cheap. So it's in the ballpark of all of them. And just on a side note, I do know the CEO, Roland Peralta, and Sophie and Giorgio's. I actually met them in Vegas one time, and this is like when they were kind of a young company, and they're really great people. Like just on a side note, because that doesn't really talk about the product, but it's a good product and they're good people. So yeah. So I want to move on to some of the more prescription drugs because that would be more of a supplement. And I'm sure, Travis, have you ever heard of the two big ones for hair loss? I hate to put you on the spot. If you don't know, I'm sorry.
I have not.
You haven't? Okay, all right.
I think it maybe like Rogaine.
Yeah, it's it. You got it, buddy.
Yeah, Rogaine is
nailed it. Right.
I don't know the other one.
So there's two big prescription drugs out there. Rogaine's the proper name. The trade name. Well, no, it's a trade name. The generic name is minoxidil.
Okay.
Okay. So minoxidil is kind of an interesting product because it was created for something else, and it was found that it actually caused hair to grow. And the mechanism of action is a little unknown, which is interesting. It's kind of one of those products that causes the side effects, and we're not 100% sure why it is. And so basically it's something you put on your scalp. It's a prescription, and it has research that backs it up. And so when people use minoxidil regularly, 2 out of 3, so around 60-65% of people had either good or very good growth of hair. Mm-hmm. And so it does work. It's got the research. It does have one potential side effect, which is to cause irritation of your scalp. So there's that. It is something you have to use twice a day, which I'm always think about these things. So I'm thinking about products,
Do you have to use it like forever?
Yeah. That's the thing. See, that's a great question. The very first question people should ask is, do you have to keep using it? And the answer is yes. Like if you use it and you get results and you quit using it,
does your hair just like fall out?
It'll start to fall out. Yeah.
Wow.
It will, absolutely. That's the only downside to some of these things is, that's why, and I think even that very first one, that peptide thing, you would have to get repeat. Like, I guess maybe it's not a cure, it's like
a treatment.
Yeah, I mean, yeah. It's a treatment that can be permanent if you keep using it. So there's minoxidil. The other one is finasteride. That's a generic name, or Propecia. And this is a pill that you take, and we know how this one works. It actually stops the conversion of testosterone to DHT. Okay. DHT is that product which tells those cells to turn off. And of all of the treatments, looking at the research, Propecia is the best. There was a research paper, big paper done about that. And in that paper, it's anywhere from 83 to 90% of people had either a stopping of baldness and or a restoration of their hair. Nice. And so I actually have personal experience with this, like being, fully transparent. So when I was like kind of in my 20s, I noticed that I was starting to, lose my hair a little bit. My dad was bald, my grandparents were bald. And so I started taking finasteride in, I think, 2005. And so, Travis, I have a picture. I dug up some pictures. So the top picture there is me in around 2005, and you can see that like my hairline's not great, And then in the bottom picture, that's me like a few years ago, my daddy-daughter dance. Like I used it because the hairline you can see clearly.
Yeah, you can.
It's much better, right? And even on camera, like now, you can see that my hair's pretty good.
Right.
And if I was losing my hair that much in my mid-20s, if I hadn't started taking it, I'd probably be completely bald now.
Right.
Now there are some downsides to finasteride, which they're kind of minor. They're side effects. Now, I personally have had none of them because that was the big thing when people talk about Propecia and finasteride. It's like, are you going to have side? So the side effects are possibly depression, which I've never noticed, decrease in sexual drive, which I never noticed, and erectile dysfunction, which I never noticed.
Well, good.
Yeah, I know, right? You
For your wife.
Yeah, I know, right? You look at those, you're like, geez, I don't know if I want to take this drug.
Yeah.
That's really it, though. It's not like, risk of death or anything like that. So, like, you know what, I'm going to try it. And I had 0 side effects. And I actually went and talked to a urologist after a few years because, like, okay, I've been taking this forever now. Is that, like, bad? And urologist's like, no. Actually, it's protective for things like prostate cancer. So there are actually some other benefits from it. In fact, that drug was designed to treat increased prostates, or enlarged prostate.
Oh, so it's like is the pill like not specifically designed for men, but is it geared towards mostly like a men demographic?
It was created for enlarged prostates.
Okay.
And so, but they noticed that the people that take it got their hair back.
Wow.
It's crazy, right? It's like there's a lot of drugs like that. They were created for one thing, and then they figured out, you know what other ones like that? Viagra. Viagra was created as a blood pressure medication.
Wow.
And then people found, they said, well, do you have any other symptoms? Like, yeah, I keep getting these erections that I couldn't get. And so, like, Viagra was created the same way. So.
What an awkward thing to go to your doctor about.
I know, right? Well, now
so
that you can,
I have a problem.
Yeah, I have a problem. It's kind of like a, anyway. So those are the medications. And lastly, there is surgery for hair loss. I've actually done some of these surgeries. This does fall in the realm of plastic surgery, which is hair transplants. Also, dermatologists can do them. And I did some when I was in training because, when you're in training for plastic surgery, you do a little bit of everything, right? And there's some things that you'll end up not doing. Like I don't do nose jobs anymore, and I don't do the hair transplants. But they are pretty good surgeries. I think I brought a picture. Now, this picture is courtesy of Bosley Hair Restoration. Now, Bosley's been around forever.
Yes.
Like decades. Like the original Dr. Bosley is like, I think he might have passed away, but he's like from 40 years ago.
Oh, I remember watching commercials.
Yeah, the commercials, right? Yeah, you see him on TV. So this is a pretty good representation. So the way they do the surgery is there are certain areas of your scalp which you will not lose your hair, even if you go bald, sides and the back. So what you do is you take a strip of hair out of that area where the hair will go bald, and you actually cut those hairs into individual hair follicles, and then you implant them into the area that you do go bald. And just like fat grafting, you plug those things in, and your body like just accepts them and they take, and it actually works very well. And I will say it's one of the reasons I didn't like it. It is the most meticulous surgery ever. And so there's a lot. So that's funny with plastic surgery. A lot of surgeries you consider artistic, and some are more meticulous. I'm much more leaning towards the artistic stuff.
Yeah.
So like just kind of the monotony of slicing up hairs and injecting them, I was like,
Sounds very tedious.
very tedious. Like the other thing is like microsurgery, which is part of plastic surgery. I never really liked because it was just so tedious. I'm more like, I want to make something beautiful, you know? So, so I don't do the hair transplants anymore. I never did them really outside of training, but they do work pretty well. So
Nice.
anyway, so that's a nice kind of recap. You know, baldness is a big problem for people, and you know, as somebody who was starting to like go through it, like it's psychologically, you know, harmful.
Definitely.
Right? And I don't think a lot of people know that there are some great treatments out there. You know, whether you want to do the supplement route like Nutrafol, or you want to do like some of the prescription drugs, or you know, if you want to go the route of surgery, I would tell people that want to get it treated that it's best to start early. Like if I'd gone completely bald and then I started doing these things, I probably wouldn't have.
Yeah, prevention is key.
Yeah,
with
what is
anything.
an ounce of prevention is worth a pound of cure. Yeah, right.
One thing, Dr. Hermann, so it's funny that we are having this conversation. Last week, I went to the barber shop, right?
Okay.
And my barber was telling me that another client was using Rogaine on his face. So like
on his face?
For his beard. He was saying basically
his beard?
Yes.
Oh my God.
What he does is he takes like a roller. I guess there's a roller with like these little pins in them.
Okay.
He takes the roller and then he rolls his face and then he puts the Rogaine on his face and it helps his beard, I guess, grow. I'm not sure if there's any scientific support for that, but that's another like use for, I guess, the Rogaine.
Wow, that's very interesting.
Maybe, I don't know.
Yeah,
he DIY'd that.
I'm gonna have to look into that. I haven't heard of people
Absolutely.
using it like on their face, but
Yeah.
okay. Last segment is the NipTech 911, and so I saw a really interesting article in Huffington Post, and it was talking about everyone's obsession with policing celebrities for plastic surgery. It's something that has gotten a lot of popularity due to social media. I know I was asking you, Sarah, about this. Travis, have you on your social media feeds? Do you see these people that are looking at these different celebrities and trying to guess what plastic surgery they had?
Oh, absolutely. All
yeah,
the
it's
time.
like really common, right?
Yeah. Who had a nose job?
Yeah.
Or who got their lips done? Or
So
anything like that.
there was this really kind of interesting article on Huffington Post about that, and it was basically talking about like why is this so popular, right? And they were kind of digging into it, which I thought was pretty interesting. And so I think a lot of it is, and they were kind of saying the same thing, is that celebrities are a little secretive about it. Like they don't want to talk about it. And so like their fans are left like guessing, you know, have these people had surgery or not? And so also too, you know, you look at these celebrities, you know, they look so great, and you're wondering like, do they just look this great naturally, or like what are they doing? People want to like, you know, kind of do what they do.
Yeah.
And so, I mean, there's a lot of reasons why these kind of videos have like gotten really popular, and it's not just plastic surgeons doing it.
Yeah.
There's like nurses doing it. There's like estheticians.
I think that this whole, like the whole unattainable beauty standard, they're trying to like just cut that and, you know, make it to where like these are normal people and they're getting plastic surgery just like any normal person if they're not happy with their nose, their lips.
Right.
And if they're not happy, they're just trying to make themselves happy.
Yeah, yeah, definitely.
And there's nothing wrong with that, really.
Totally nothing wrong with that. You know, the one kind of critique that this article was talking about, and there was actually this plastic surgeon that was kind of like being harsh on celebrities, which I was like, oh wow. He was basically saying that his concern, which I kind of agree, is that some celebrities will go and do procedures, like say liposuction, and then they'll go and tell their fans, oh, I look this good because I like work out. And then people will get these unrealistic expectations.
There's a story about Kylie Jenner. She did like a whole like lipstick, or she still has that company. And there was like this whole big thing about her lips, and everybody thought that they were her real lips, and they weren't. And she was telling people that her lips were just overlined with
right. She was telling people
liner.
that the product would make her lips look like that when really she'd had fillers.
Yes.
Yeah, I mean, see, and that's where I kind of agree with this guy who was, you know, he was being a little harsh, saying, yeah, well, these celebrities need to be honest with people because one, people are getting these false expectations, and what happens sometimes, you know, they would come into him and, you know, have these expectations of procedures based on what celebrities were saying that was not correct, you know. And then also it's deceptive, right? I mean, if Kylie Jenner is like getting money, you know, saying that this product,
her company is doing just fine.
Really?
Yeah, I have some of her lip gloss.
Oh, do you?
I think it's because she was just like, yes, okay, I have lip fillers, like.
Oh, she did. She ended up saying.
Yeah.
Oh, okay. So she ended up saying she did have lip fillers.
Yeah, I think it was just at the beginning when she first started. because I think she got lip fillers like right when she turned 18.
Did she?
Yeah,
Her
because she's
company-
pretty young.
Isn't her company like $1 billion company too
Yeah.
at this point now? Like, yeah, she's like, oh,
She's rolling in it.
Wow.
Absolutely.
That's crazy,
Makeup.
man.
That's her
Highly
thing.
We need to start the Nip Talk makeup line, or maybe like a line of bras. I don't know. Like,
Might be okay.
all right, we'll put a pin in that. We'll come back to what product we make. So the other thing was asking is, are these videos harmful? And so like the first thing is like, well, what is the effect on the celebrities? I don't know. Like not to be like cold, but like, I mean, if you're a celebrity, you have to expect that people are going to critique you, right? I mean, it's one of the downsides, it comes along with fame, right? People are going to look at you and, possibly criticize you. So I don't know, like, I mean, I don't get super concerned about that. But, one of the potentially two problems is that, you sometimes get people who see these celebrities and they want to mimic them. And so they'll go and seek out procedures. Like what we were just talking about, the Brazilian butt lift, right? They look at someone like Kim Kardashian and then they want to go do a procedure to look like that. And I mean, to a certain degree, that's fine, I guess. But like, I mean, it can become problematic, I think, when patients like possibly can't get a safe result, and they just keep pushing the envelope, like they're getting more and more lip filler or more surgery.
This becomes like an obsession.
Yeah, it becomes an obsession, right?
Yeah, because like the fact of the matter is like if they are trying to look like Kim Kardashian, they're never going to look like Kim Kardashian because it's Kim Kardashian.
Yeah, I mean, maybe you can like get something similar, but like it can become pathologic where they're just trying to like so hard
Definitely.
to people. And the other thing too is like there was some comments about like is this causing body dysmorphic disorder in people where they they look at these things and they think, okay, well, I'm never going to look that good, and does that have a harmful effect? And I mean, I think that there's probably some truth to that, but I mean that happens even long before, these plastic surgery things came about, like all the models and the magazines.
Self-image, it's always been an issue for sure.
So the other question I kind of wanted to like go over is, okay, do I do these things? And really I don't. Like, I mean, not to the degree that a lot of these people do, because I mean, for one, I think it's a little kitschy. Like it's like it's kind of a fad, and like I don't want to be that guy that's just jumping on some fad. Now I will say that when there have been some we've looked at, and I think we looked at Courtney Cox at one time, and there's people who said, okay, I had plastic surgery and I was unhappy with it, and so I felt like that was more of an educational thing. Like we could look at their picture that they were unhappy with and say, okay, why were they unhappy? Did they do things that maybe were too much? So I'll do like educational stuff, but like I don't know, some of it I just like I'm not interested in kind of going down that road of.
Yeah, I mean, I've had breast implants, and a lot of people have asked me like, do I regret getting them, all that kind of stuff, and my answer's always been no. But that's because like I never really had an issue with how I looked. Like I was like, I just want them.
Right. Yeah. Exactly. Right.
It's not because I don't think I look good. It's just because
and that's
I think it'll make me feel good.
That's the proper attitude to go into it. Like if people like. Although I'll say some people come in, they'll have some like really concerns about themselves, do surgery and they'll feel better. But like, you have to be careful where people are just overcritical of themselves, because then you'll do surgery and they won't.
No matter what they do.
No matter what they do. Yeah, that's the body dysmorphic disorder.
Yeah.
The other thing that does bother me kind of on this trend, and we had an episode we talked about this, is I don't like when either plastic surgeons or estheticians will pop up some beautiful celebrity and say, this is what I want to do to this person. I don't know. I just think that's kind of wrong for a couple reasons. One, I just think it's wrong, even for celebrities who I think should be,
it's definitely distasteful.
It's distasteful, right? It's just not professional. And then the other thing I don't like about it is the average person looking at that video of this beautiful celebrity, like there was the girl from Stranger Things, and then Paulina Porvaskovich had this happen to her. She's like a supermodel from like the 80s. And so there's these beautiful people, and some expert, in quotes, is saying, oh, this person needs this treatment, and that treatment, and that treatment. I think that sends a wrong message, because the average person is going to look at that celebrity and be like, that person's beautiful, like I'm screwed, right? Like if they need all that, then it's hopeless for me.
Yeah, it's feeding into that that unattainable beauty standard.
Right. Yeah, so I don't like when people do that. And like we did a little segment on that, I found a few episodes back, which is kind of interesting. So anyway, I think it's a good topic though. Yeah. So Travis, I think it's about the time
Uh-huh.
we go to the Q&A.
Absolutely.
Do we have any cues today?
We do.
We do. Good.
We have
That
a
makes
few.
me happy.
So Nikki asks, what is the ideal age to start Botox and fillers? Any recommended preventative maintenance for getting Botox and fillers? Or before getting Botox?
Oh, before you. Okay, so two-part. All right, so this is a very common question, and it can be a little complex. So
I'm interested because
Now,
I've talked about getting some.
have you used Botox before?
No.
Oh, we're gonna have to talk.
Yeah.
Well, you might learn something from this. So I have said this before. Like, I truly believe that Botox is like the lowest hanging fruit of making yourself look young. You know. Because one of the things that makes people look aged very quickly are the wrinkles here, your frown lines, your forehead lines, and your smile lines, okay? And that's one of the first things that make people look older. And so if you use Botox, which paralyzes your muscle, you can literally never develop those. And my wife is like the perfect example of that. Like my wife has been using Botox for 15 years, and she doesn't have a wrinkle on her face, and we're in our late 40s. I mean, it's kind of crazy. And so I think that if you really want to be proactive, people should start using Botox around 30. Because there's very few like 20-year-olds that are starting to develop the lines. But when you get into your 30s, you'll start to see people getting these passive lines that make them look more aged. So I'm never that person that tells people, oh, you need to go get this or that. But I mean, if you ask me straight out, when's a good idea to get Botox? Around 30. Now, fillers is a different question because for one, fillers can be used for two different things. Like I get a lot of girls in their 20s that want lip filler just to look a little bit better. And I think that's totally fine. I mean, that's their call to do it. But like doing it to increase or to make you look more young, like here in your folds here or here, that's more something people do in their maybe 30s or 40s. So, and then preventative, Travis, probably the best thing is skincare. Staying out of the sun, using good skin products, that does make a difference. So, Thanks, Nikki, for that question. Thank you.
Absolutely.
You got any others? We have time for one more.
Yeah, we do. One more. Dwight.
Dwight, my buddy Dwight.
Yeah, Dwight Crownover. He says, when doing a fat grafting instead of breast implants, what is the percentage of fat lost during the healing process?
Yeah, excellent question. And one of the most important things when I go over and talk about fat grafting. So if you properly process the fat, which I always do with mine, I have a really good system, which I think is one of the best, you can expect to keep about 80%. That's a good number.
Yeah.
So what I normally do when I do fat grafting is I overshoot my result, okay? If I want to get a result that's this big, I'll actually make it this big. I mean, if you can see that in the picture. I go a little bit over knowing that they're going to lose some. Now, that does leave a little bit of unpredictability. And so when I have patients that want to do an augmentation via fat grafting, I very clearly explain that there is a possibility that it may not be perfect, which is fine. I mean, the classic saying for breasts is that breasts should be sisters, not twins. It's very common for great breasts to look slightly different one to the other. So a little bit of difference is okay. But with implants, you have more control. So when I have people that want to talk about doing fat grafting, I always go over, okay, this is a possible thing that can happen. Now, if somebody goes and does fat grafting improperly, I mean, you could lose up to 75% of the fat. And we talked about that when we were talking about the BBLs.
Yeah.
That fortunately with breasts, you don't need as much. Remember we talked about butts, you need 300 to 1,200. When I do fat grafting for breasts, I do anywhere from as low as 50 if it's spot for reconstruction, maybe 100, 150 for a small augmentation, but probably never more than 200 or 300. So you can get away with it, right? Because you have plenty of fat, and injecting less kind of decreases some of the problems that might pop up. And so it's not my favorite thing to do for augmentation, but it does have its uses.
Nice.
Travis, are we about out of time?
Yeah, I think that's about the time we have for today.
All right. Well, it was a good episode today.
Yeah, I had fun.
Thanks. Thank you so much, Sarah, for coming.
problem.
Maybe you could come back sometime.
For sure.
Awesome. All right, everybody. Well, thank you so much for watching Nip Talk this week. Nip Talk, sorry. We will have some great topics coming up next week. Already working on. It's going to be some interesting stuff. Travis, thank you for your great job as always. And we will see you guys next week.